Hello guys, welcome back to Medico. So today I've come up with the part 2 video of the 6 parts, and this video is released for content review and error correction. It's a draft version meant for topic collection and feedback. The final version will be released soon. So the 26th question, a 14-year-old boy presents with pain and swelling over the right humerus for 2 months. He also has fever and raised ESR. Blood tests show leukocytosis with neutrophilia. X-ray of the humerus is shown. Which of the following is the next test to confirm the diagnosis? Answer is MRI of the affected limb. So the presentation here with the X-ray showing a periosteal reaction and bone destruction such as Ewing sarcoma or osteomyelitis. MRI is the best test for diagnosis and delineating the extent of the involvement of the bone and soft tissue. CT-guided biopsy is confirmatory, but MRI is the best initial investigation to confirm the radiological diagnosis and local staging. Next question, a 28-year-old man with involuntary jerky movements of the face and limbs that have gradually worsened over the past year. His family reports personality changes, irritability and progressive forgetfulness. On examination, he has coriform movements involving both upper and lower limbs and an unsteady gait. Which of the following is the most likely diagnosis? Answer is Huntington's disease. So here the key features like chorea, personality changes, irritability and progressive dementia or forgetfulness is classic for Huntington's disease. MRI shows atrophy of the caudate nucleus with dilated frontal horns of lateral ventricle. Inheritance is autosomal dominant, CAG trinucleotide repeat expansion on chromosome 4. And the others like in tardive dyskinesia from long-term antipsychotic use it can come, and Sydenham's chorea post-streptococcal infection in children it happens, and Tourette syndrome it is there will be motor plus vocal tics and it is not progressive dementia. Next question, a 55-year-old chronic smoker presents with drooping of the right eyelid, constricted pupil and absence of sweating on the right side of the face. He also complains of shoulder pain and tingling sensation in the right arm. The chest x-ray is given below. Which of the following is the best investigation to confirm the diagnosis? Answer is CT-guided biopsy. So here the diagnosis is Pancoast tumor. This had come previously in Neetpg also. Apical lung carcinoma causes the Horner's syndrome. So the patient has Horner's syndrome, which has the features of ptosis, meiosis and anhidrosis, plus shoulder pain and arm paresthesia, which strongly suggests a Pancoast tumor, which is a superior sulcus tumor. X-ray finding is the apical opacity in the lung apex region, which is shown here. And best investigation to confirm is the CT-guided biopsy. It provides tissue diagnosis of the suspected bronchogenic carcinoma, and supportive investigations like contrast CT, chest, MRI and PET scanning can also be done. Sputum microscopy is often negative in apical tumors due to the peripheral location. Next question, a 35-year-old man presents to emergency department with sudden onset shortness of breath. Below is a CT of the patient. What is the next best step in the management? So here answer is needle thoracostomy. So the CT shows massive pneumothorax causing lung collapse, which is classic for tension pneumothorax. The patient presents with sudden onset dyspnea, an emergency situation requiring immediate decompression. So the next step here is needle thoracostomy in the second intercostal space in the midclavicular line to rapidly relieve the intrathoracic pressure and prevent the cardiovascular collapse. This is followed by definitive treatment with intercostal chest tube insertion in the fifth intercostal space in the midaxillary line. Next question, a 42-year-old man presents with 3-month history of cough that recently became productive. He also reports 1 episode of hemoptysis. Chest x-ray of the patient is given. What is the most likely diagnosis? Answer is pulmonary TB. So the symptoms like chronic cough more than 3 months, hemoptysis and productive sputum strongly suggest TB. Pulmonary TB, reactivation type with upper lobe cavitary lesion is here. So x-ray findings, there is a cavitary lesion with upper lobe predominance and it may show infiltrates and fibrosis. Differentiation from the other options. So lung abscess, there will be a single cavity with air fluid level and acute presentation with fever. In case of metastatic carcinoma, multiple nodules or cannonball opacities can be seen on X-ray. And in bronchiectasis, there will be dilated bronchi, often bilateral, lower lobe disease with chronic sputum. Next, identify the marked structure in the below image. So here the answer is carotid canal, which is marked. The gate is located in the petrous part of the temporal bone. It transmits the internal carotid artery and the sympathetic plexus into the cranial cavity. The radiological features seen on CT, temporal bone as a bony canal running anteromedially from the inferior surface of the skull. It lies anterior and medial to the jugular foramen and antero-inferior to the cochlea. So other options can be excluded. The reasons for differentiation are mentioned here. Next, a patient presents after a fall on an outstretched hand with pain, restricted shoulder movement and a prominent shoulder contour. The given X-ray shows the following findings. Identify the condition. So answer here is anterior dislocation of the shoulder. X-ray shows the humeral head displaced anteriorly and medially in relation to the glenoid fossa. The humeral head is seen below the coracoid process. In that is the subcoracoid dislocation, the most common type of anterior dislocation. Mechanism is fall on an outstretched hand, that is the fouche, with arm abducted and externally rotated. So the complications are axillary nerve injury, which leads to loss of sensation over the deltoid patch, then the Hill-Sachs lesion, which is a posterolateral humeral head indentation, and the Bankard's lesion, which is the tear of the anteroinferior labrum. Next question, which of the following statements regarding dronabinol is correct except? Answer is, it is excreted unchanged in urine. So dronabinol is a synthetic cannabinoid CB1 receptor agonist. It is used for ACE-associated weight loss and chemotherapy-induced nausea and vomiting. It is highly lipophilic and undergoes hepatic metabolism, and so not excreted unchanged in urine. Krukenberg spindle is seen in which of the following conditions? Answer, pigmentary glaucoma. So Krukenberg spindle will lead to vertical spindle-shaped pigmentation seen on the posterior surface of the cornea, the endothelium. It is caused by pigment dispersion from the iris pigment epithelium, which deposits on the corneal endothelium. It is characteristic of pigmentary glaucoma, and pseudo-exfoliation syndrome will show white flaky deposits, not pigment spindles. So the next is a multiple correct answer question. Which of the following methods is used to assess visual acuity in a preverbal child? Answer is Steller's chart and optokinetic nystagmus. So preverbal child cannot read or identify symbols, hence objective or preferential looking methods are used to estimate the visual acuity. So there's a disclaimer here. This is a part 2 of the 6 videos of Medico Days MCQ compilation series containing 10 questions. The current version is intended solely for academic review, topic collection and error rectification. Content is in progress and may include draft level questions, options or explanations that are subject to modification. So the purpose of this release is to gather feedback, identify inaccuracies and refine the content for final version. The complete and verified version will be released soon as part of the Medico Notes full edition. Thank you.